Why most people imagine a heart attack as something dramatic. A sharp pain, a desperate cry for help, a person clutching their chest and collapsing in front of everyone. But real life is often quieter than that, especially at night. Some of the most dangerous heart and stroke events do not begin with panic. They begin with routine. They begin in silence. They begin while a person is sleeping, or trying to sleep, completely unaware that their body has been under strain for hours. And that is exactly why this matters. Because many people spend all day worrying about the wrong things, while ignoring the habits that may be putting the most pressure on their heart after sunset. I'm Dr. Olivia Hart, and if you are over 50, over 60, or you care about someone who is, I want you to listen very carefully to what I'm about to say. The body does not simply switch off at night. Your heart is still working. Your blood vessels are still responding. Your nervous system is still regulating pressure, oxygen, fluid balance, and circulation. In fact, the hours before bed and the first hours of sleep may be some of the most important hours for cardiovascular recovery. That means what you do in the evening matters more than most people realize. And tonight, I want to talk about one of the biggest mistakes people make with heart health. It is not always one single action. It is often a pattern, a very common nighttime pattern, a routine that feels harmless because it is familiar, but repeated night after night, month after month, year after year, it may quietly increase the strain on your heart, your blood pressure, your sleep quality, and in some people, even your stroke risk. The good news is this. These are not mysterious dangers. These are habits you can recognize. These are habits you can change. And once you understand them, you can create an evening routine that works with your body instead of against it. So let's begin with the first mistake, because this one is incredibly common and almost nobody thinks of it as a heart issue. A late, heavy dinner. Let me ask you something. How often do you eat your largest meal at the end of the day? How often do you eat at 8 p.m., 9 p.m., sometimes even later, then sit down, scroll on your phone, watch television, and go to bed not long after? For many people, that feels normal. In some households, that has been the routine for decades. But your body does not treat a heavy late-night meal as a small event. It treats it as work. When you eat a large meal, especially one high in fat, sugar, salt, or refined carbohydrates, your digestive system demands energy and blood flow. Your blood sugar rises. Your insulin response changes. Your body temperature can shift. If the meal is especially heavy, you may also experience reflux, bloating, poor sleep, or a restless night. And here is where the real problem begins. Nighttime is supposed to be the period when your body settles down. Blood pressure should gradually ease. Stress hormones should decrease. Sleep should become restorative. But if your system is still busy processing a large meal, your body may not move into that calm recovery state as smoothly as it should. That is one reason health authorities consistently recommend avoiding food and especially heavy, high-fat, or high-sugar eating close to bedtime (CDC). The American Heart Association has also highlighted links between irregular or late pattern eating and changes in blood pressure, body weight, and blood sugar regulation. American Heart Association. So what should you do instead? Simple. Try to finish your main dinner earlier. If possible, give yourself a few hours between your last full meal and bedtime. If you truly need to eat later, keep it lighter. Think balance, not overload. Lean protein, vegetables, reasonable portions, food that nourishes you without forcing your body into overtime while you should be winding down. You do not need perfection. You need a pattern your heart can live with. Now let's talk about the second mistake. And this one is even more dangerous because people often laugh it off. Snoring, or more specifically, untreated sleep apnea. There are millions of people who say the same thing. Oh, I've always snored. My spouse says I sound like a chainsaw. I wake up tired, but that's just age. No, not always. Sometimes snoring is more than noise. Sometimes it is a warning. When a person has obstructive sleep apnea, The airway repeatedly narrows or closes during sleep. Breathing becomes shallow or pauses. Oxygen levels can drop. The brain senses a threat and briefly pulls the body out of deeper sleep to reopen the airway. This can happen again and again across the night. And when it does, the cardiovascular system does not get a peaceful night. It gets repeated stress. The CDC notes that sleep apnea increases the risk for high blood pressure, heart attack, and stroke. CDC. The American Stroke Association also notes that more than half of people who have a stroke also have sleep apnea, and common signs include snoring, waking up gasping, daytime fatigue, and morning headaches. American Stroke Association. Think about what that means. A person can lie in bed for 7 or 8 hours and still never give the heart the recovery it needs. That person may wake up exhausted. They may feel foggy in the morning. They may think they just need more coffee. They may blame stress, aging, or a busy life. Meanwhile, their body may have spent the entire night cycling through oxygen drops, adrenaline surges, pressure changes, and poor quality sleep. So if you snore loudly, if someone has told you that you stop breathing, if you wake with headaches, dry mouth, or overwhelming fatigue, do not brush it off. Get evaluated. This is one of the biggest ways people miss an important health problem simply because it happens in the dark. The third mistake is one that sounds harmless because it has become normal for modern life. An overstimulating final hour before sleep. I'm talking about the bright phone screen in bed, the stressful emails at 10:30, the social media scroll that somehow turns into an extra hour awake, the upsetting news, the emotional videos, the online arguments, the habit of taking your nervous system into overdrive right before asking your body to rest. We tend to think of this as only a sleep issue, but poor sleep and heart health are tightly connected. According to the CDC, adults who regularly sleep fewer than 7 hours are more likely to report problems including high blood pressure and even prior heart attack, and poor sleep patterns can hurt long-term cardiovascular health, CDC. Here's what people often forget. Sleep is not a switch. It is a transition, and the body needs help making that transition well. If the final hour of your night is filled with bright light, mental stimulation, emotional agitation, or inconsistent timing, you may fall asleep later, sleep less deeply, or wake more often. Over time, that can become its own form of strain. The American Heart Association has even pointed out that irregular sleeping habits may increase cardiovascular risk, especially in older adults, AHA News. So what do I recommend? Protect the final hour before bed. Make that hour calmer than the rest of your day. Lower the lights. Reduce the noise. Step away from conflict. Put the phone down earlier than feels convenient. You do not have to make your evening perfect. You just have to stop training your body to stay alert at the exact moment it should be letting go. Now let's move to the fourth mistake, and this is one many older adults make for a practical reason. Going to bed underhydrated. This happens all the time. People deliberately stop drinking in the evening because they do not want to wake up and use the bathroom. That reasoning is understandable. But when people take it too far, it can backfire. Dehydration affects circulation, blood volume, energy, blood pressure, and overall physical function. It can be especially important in people who already have vascular disease or narrowed blood vessels. UT Southwestern notes that dehydration can reduce blood volume and make it harder to maintain adequate blood flow, which is particularly concerning for those with conditions that affect circulation. UT Southwestern. I want to be careful here because I do not want to oversimplify this. Drinking water before bed is not some miracle cure, but neither is chronic underhydration harmless. If you are someone who barely drinks fluids in the evening, wakes up dry, feels thirsty overnight, or regularly starts the morning already depleted, that is worth paying attention to. What works best is moderation. Do not large amounts right before sleep, but do not treat hydration like the enemy. Know your body, Talk to your doctor if you have heart failure, kidney disease, or a fluid restriction. But if that does not apply to you, aim for sensible hydration across the day so you are not arriving at bedtime already running low. Sometimes the best protection is not dramatic, it is just avoiding the slow, repeated strain of doing basic things poorly. Now, the fifth mistake may surprise you, because almost no one thinks of it as part of heart health. Your bedroom environment, especially temperature. A room that is too hot can worsen sleep quality. A room that is too cold can also disturb the body. According to Cleveland Clinic, the general range often recommended for adults is around 60 to 67 degrees Fahrenheit, or about 15 to 19 degrees Celsius, because temperature plays a major role in staying asleep and maintaining restorative sleep stages. Cleveland Clinic. Why does this matter? Because the body needs to regulate temperature to sleep well. If the room is too warm, you may become restless, sweat more, wake more often, and spend less time in the deeper sleep your body needs. If the room is too cold, blood vessels may constrict and your body may work harder to stay warm. Cleveland Clinic notes that being too cold can put extra pressure on the cardiovascular system as the body tries to regulate temperature. Cleveland Clinic. Again, this is not about fear. It is about understanding. A bad sleep environment does not just make the night annoying. It can reduce the quality of the recovery your heart and brain are supposed to be getting. And when poor nights happen occasionally, the body usually adapts. But when they become the standard, the cost adds up. Now there is another issue I want to mention because it is often mishandled in videos like this. Blood pressure medication timing. You may have heard people say that everyone should take their blood pressure medicine at night. That is too simplistic. Some people do take certain medications in the evening. Some are told to take them in the morning. Some need the schedule adjusted based on symptoms, side effects, adherence, or other medical conditions. Cleveland Clinic's review makes this very clear. Current evidence does not support a universal rule that nighttime dosing is better for everyone, and the most important thing is taking medication as prescribed and discussing changes with your clinician. Cleveland Clinic. That means this is not the part where I tell you to change your pills tonight. It is the part where I tell you to ask a better question. If you have high blood pressure, ask your doctor whether the timing of your medication is right for you. Ask whether your readings are well controlled. Ask whether you have morning surges. Ask whether you may benefit from a different schedule. That is what responsible heart care sounds like. Not random advice. Personalized advice. Now let's step back and look at the bigger picture. What is the common nighttime habit that may be raising heart and stroke risk? It is not just one isolated move. It is the habit of treating the final hours of the day carelessly. Eating too late. Sleeping too irregularly. Ignoring snoring. Staying overstimulated until midnight. Running low on hydration. Sleeping in a room that works against good rest. Skipping the conversations that matter about blood pressure and sleep quality. In other words, it is the habit of assuming that nighttime does not count. But nighttime does count. It counts because this is when the body is supposed to repair. It counts because blood pressure, oxygen, hormones, and recovery are still active. It counts because some of the risks people fear most do not begin in public. They begin in private, in ordinary bedrooms, in ordinary homes, during ordinary evenings that looked completely harmless. And that is why I want to give you something better than fear. I want to give you a simple evening blueprint. If you want your script to feel powerful and useful, this is the part that people remember. This is the part that turns anxiety into action. Here is the routine I would want more people to follow. Eat earlier when possible. Do not make your heaviest meal the final event of the day. Give your body time to digest before you lie down. Make your last hour quieter. Less screen light. Less stimulation. Less emotional chaos. If you snore, do not joke your way past it. Pay attention. Ask questions. Get checked if the signs are there. Hydrate sensibly across the day, and do not arrive at bedtime feeling depleted unless you have been medically told to limit fluids. Keep your bedroom cool, dark, and calm. And if you take blood pressure medication, do not guess your way through it. Follow instructions and review the timing with your doctor if you are unsure. That is it. Not glamorous, not dramatic, but meaningful. And that is exactly why it works. People often wait for health advice that sounds revolutionary. They want the hidden secret. They want the forbidden food. They want the one surprising trick. But in medicine, many of the most important protections are not dramatic at all. They are consistent. They are repetitive. They are ordinary decisions made well. A heart attack can feel sudden. A stroke can feel sudden. But the habits that help create risk are often not sudden at all. They build quietly. And so does protection. Protection also builds quietly. Every earlier dinner, every calmer night, every time you choose sleep over stimulation, every time you take snoring seriously, every time you create an environment that allows the body to recover instead of fight through the night. That counts. And if you are someone listening to me right now thinking, I do at least 3 or 4 of these things, I want you to hear me clearly. This is not a reason to panic. This is a reason to act. You do not have to fix everything in one night. You just have to stop calling harmful patterns normal. That is where change begins. Maybe tonight your change is finishing dinner earlier. Maybe it is putting the phone down 45 minutes sooner. Maybe it is lowering the room temperature. Maybe it is finally taking your partner's complaints about your snoring seriously. Maybe it is booking the appointment you have been postponing for months. That is how real prevention looks. Not fear without direction. Awareness followed by action. And I also want to say something to the people listening for someone they love. If this sounds like your husband, your wife, your father, your mother, your brother, your sister, or your closest friend, please do not assume they already know. Many people do not connect nighttime habits with cardiovascular risk at all. They think heart health begins and ends with cholesterol, sugar, and exercise. Those things matter. Of course they do. But sleep, timing, consistency, oxygen, hydration, and evening habits matter too. Sometimes what protects the heart is not one big intervention. Sometimes it is a better night, and then another better night, and then a better pattern repeated often enough that the body finally gets the conditions it has been needing all along. So before you go to bed tonight, I want you to remember one thing. Your heart does not disappear when the lights go out. It keeps working for you. It keeps adapting to what you gave it during the day, and especially what you gave it in the final hours before sleep. So give it something better. Give it less strain. Give it more recovery. Give it an earlier meal, a quieter mind, a cooler room, better sleep, and if needed, real medical attention instead of denial. That is not small. That is powerful. And it may matter far more than people realize. I'm Dr. Olivia Hart, and if this message helped you see your nighttime routine differently, then take that insight seriously. Do not wait for symptoms to force the lesson on you. Start with tonight. Sleep is not wasted time. Nighttime is not empty time. It is healing time, or it should be. And the more you respect it, the more your body may reward you for it. One final note before we close. This information is educational. It is not a substitute for personal medical care. If you have chest pain, severe shortness of breath, stroke symptoms, repeated nighttime choking, uncontrolled blood pressure, or any concerning symptoms, seek medical attention promptly, and before changing medications, especially blood pressure medication, speak with your own doctor first, CDC Cleveland Clinic. Take care of your heart tonight, not someday, because sometimes the most dangerous habits are not the loud ones. They are the quiet ones you repeat every evening without realizing what they may be costing you.